I'm Emily English. I am a urogynecologist here at Metro Health in Grand Rapids. I treat what are called pelvic floor disorders, which is sort of a broad term that refers to a lot of different conditions and symptoms. What I think of most is urinary symptoms primarily, so women thinking about having trouble getting to the bathroom on time, having trouble with urinary control or urine leakage. There can be bowel symptoms as well, difficulty with bowel control, pelvic pain, or feeling like something's coming out through the vaginal opening that shouldn't be there. These are things that can be very embarrassing to talk about, of course, so I think a lot of women are kind of nervous about bringing it up to their primary care doctors unless they're asked. But yes, I think most women start by talking to their primary care doctor about some of these symptoms, and then they may be referred on to OBGYN or to a urogynecologist like me. Luckily here, you don't need a referral to be seen, so if a woman sort of feels that any of these symptoms that we're talking about resonate, she can just call to schedule an appointment. A pelvic floor disorder is sort of a broad term that refers to a variety of conditions that we think all stem from issues with the pelvic floor. Which is sort of a combination of the muscles and the ligaments and the connective tissue of the lowest part of the pelvis. And those systems are important in keeping the function of the bladder and the bowel and the rectum and the vagina. So it helps those organs to function normally and helps to keep them in place where they should be. There is a lot of research into the causes of pelvic floor disorders. I don't think we have a very clear understanding of one particular cause. But we think that a big part of what happens with pelvic floor disorders is some of the changes that happen just as women age and after having pregnancies and going through childbirth. That's a lot of trauma for the pelvic muscles to go through over a woman's life. And so we think that when those muscles stop functioning like they should, that's when you start to see some of these problems arise. So when it comes to treating these conditions, it really depends on what that particular woman's symptoms are. So if we're talking urinary leakage, for example, we tend to think about things like physical therapy for the pelvic floor muscles can actually make quite a difference. Sometimes there are really simple tweaks that a woman can make to her day-to-day routine that can actually make quite a big difference in her ability to control her urine and frequency of going to the bathroom. There are vaginal inserts, little flexible devices that can be inserted into the vagina that can help with urinary issues and bowel concerns as well. Surgeries for this as well. So the good news is that women really can decide if they want to pursue any treatment and then what treatment to pursue. So certainly there are some things that women can do to minimize their risk of developing a pelvic floor disorder over time. We really probably can't prevent this from happening completely, as we don't fully understand the mechanisms behind what causes this to happen. But certainly there are some things like pelvic floor exercises that a woman could do either at home or under the supervision of a pelvic floor physical therapist. You might have heard of Kegel exercises. So those are basically contractions of the pelvic floor muscles, sort of like tightening of the vaginal muscles, that if done regularly, we think really can help to decrease a woman's risk of developing some of these conditions over time. Like any other muscle though, you have to do that regularly and consistently, and sometimes that can be hard to do. So incorporating that into her routine can be very helpful. We think that doing things to try to avoid chronic straining can be helpful as well. So some of that's unavoidable, say if she has a job that requires a lot of heavy lifting or straining, but certainly trying to avoid constipation and chronic straining for bowel movements we think is important too in prevention. Really, these pelvic floor conditions can affect women of all ages. So this can happen to women in their 20s through their 80s and beyond. There's really no discrimination on age here, and we know that based on a woman's risk factors, she may be more likely to develop some of these conditions earlier in life, so it's important to get checked out. It's important for women to know that we have a lot of resources here in Grand Rapids to treat these conditions. As I said before, you don't need a referral necessarily to be seen by me anyway here at Metro Health. And there are a lot of things we can offer as treatments, starting with sort of the least invasive to more invasive options, depending on her choice. If any of these symptoms resonate with you at home, I think it's important to understand that it's sometimes hard to reach out to talk about these issues, but this is what we do here every day. We're very comfortable with this. We try to make you as comfortable as we can in our environment here, and just know that really ultimately treatment options are up to you, and there's hope that we can make this better.